Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Terry McDonnell, who is the Senior Vice President and Chief Nurse Executive at Duke University Health System, about AI's role in redefining jobs in the nursing industry. So, hi, Terry, how are you?
I'm great, G. How are you?
I'm doing well. Thank you for asking, and thank you for taking the time. I'm very excited to get into this conversation today. This is a really important topic in nursing right now. What are three things that you think CNOs need to know about how AI will impact the nursing industry?
Well, I think first and foremost, it's important that we acknowledge that it is going to have an impact. And, the hope is that it's going to be a positive one.
Mhm.
And I think that we as nursing leaders really need to ensure that we are at the front of all of this.
Mhm.
We need to be vetting, developing, engaging with industry partners, engaging with operational partners. And we also have to make sure that we bring our staff along with us and have them as part of the conversation and the development of all of these solutions that are going to be coming that are actually going to really change and transition how we care for patients and how we do the work that we do.
Mhm. Absolutely. Yeah, I think that's the biggest hope, like you're saying, is that it will be a positive impact. Because I think in some other industries, it's been a mixed bag for sure. So, what do you think are some of the biggest misconceptions about AI?
That it's going to replace all of us and that we're all going to be replaced with nurse bots.
Hmm.
Yeah, the reality is that AI has been in healthcare for a very long time.
Hmm.
But now it's to a point where it's accelerating at a pace that we need to keep up with.
Hmm.
And I think, we're always going to need human interaction and high level human processing.
Hmm. Absolutely. So, in kind of your ideal scenario, what do you think AI will look like in the nursing workforce? Like, what do you think is actually going to be the reality of the situation?
Well, I think we're going to be using it in several different ways. I think the primary way that we're going to be using it is, well, actually, I said primary, now I'm going to give you two cases. I think the two ways that we're actually going to see it have an impact is one with decision support.
Hmm.
So gone will be the days of searching long for policies and literature. AI actually helps us sift through a lot of information very quickly. So that decision support piece is really important and
Hmm.
validation. So the other way is allowing us to be proactive with things like computer vision and algorithms that will help notify a nurse if a patient is at risk for getting out of bed and falling,
Hmm.
that can be the eyes and ears of the nurse and helping them really have better understanding of what's happening with their patients. Even if the patient is in a room in a bed, the nurse doesn't necessarily need to be in all of those places at once. We'll have the ability for early notification, and it will allow the nurse to be more proactive rather than reactive. Imagine a world where there's cameras in a room, it's part of the normal care setting, and based on algorithms, the nurse will get a notification that a patient might be trying to get out of bed and they might be at risk for a fall. The
Hmm.
nurse can then intervene long before the patient's on the floor.
Absolutely. I feel like that's sort of similar to things with like virtual nursing as well. I have a feeling that those two will partner very nicely with one
Yeah,
another.
yeah.
Absolutely. So, speaking of that anxiety among nurses who believe that AI might end up replacing their jobs, how do you quell those fears and how do you make the case that it will redefine their role rather than replace it?
Education, first and foremost, and bring people along. We're doing a lot of development here at Duke, and we're letting our frontline nurses be part of the vetting, the development, and the creation of these solutions. We just opened 3 innovation units at our large academic center, University Hospital. And in those 3 units, we're testing a lot of this new capability, virtual
Mhm.
whiteboards, computer vision, other things. And the nurses are going to inform how these tools develop and how we utilize them moving forward. So it's really making sure that people understand what we're talking about when we talk about AI solutions and tools, and having them be part of the conversation and not have it be something that gets imposed upon them.
Mhm. Absolutely, yeah. I've heard multiple CNOs and CNEs make the point that it's always better when technology happens with nurses and not to
Mhm.
nurses. So I think that's super important. So speaking of innovation, that's really exciting that y'all just opened 3 new labs at Duke. That's really cool. So what opportunities are you seeing for AI in preventative care?
Oh, that's going to be a really exciting space because with remote patient monitoring, in-home robotics, I think we're going to be able to bring a lot more care out of the clinics and out of the hospitals into the home setting.
Mhm.
We know that people do better from infection risk and from recovery when they're in their home setting. I think with these tools, we're going to be able to keep people safe in their homes and get them through with remote monitoring, having in-home capability to response. We're seeing this in Japan, we're seeing it in the UK, where there's actually humanoid robotic devices that are being brought into the home setting to
Mhm.
help patients with simple things. But those simple things are really important, being able to reach for something or get something or have assistance or be able to take a blood pressure. Those are things that, people can't necessarily always do on their own. And if there's just that little bit of help, and then the information can get to a real clinician, a nurse practitioner, a PA, a physician, for rapid decision making and support, we can keep people in the home. I think that's where we're going to see tremendous impacts on population health.
Mhm. Absolutely. That's very interesting. I need to look into the robots that you're talking about in Japan and the UK. That sounds really cool. Um, so, what are you most excited about for AI moving forward as it progresses in the industry?
I think the things that I'm excited about are seeing how we're going to further develop nurse led models of care, how we're really going to be able to change how we deliver care, improve outcomes, decrease infection, decrease falls, decrease all of those harms that we worry about constantly in an acute care setting. But I think, it's going to be really interesting to see how we adapt these tools and how these tools can then help the care providers, nurses, physicians, nurse practitioners, PAs, actually be able to focus more and give more of that human interaction that everybody's been missing as we've been trying to do more with the same amount of resources. I can see a world where these tools can actually give us time back to
Mhm.
do the things that we consider to be more value add in the patient experience.
Mhm. Absolutely. Yeah, I've heard that on the physician end too, where, there's been a lot of positive feedback from patients who are like, my doctor actually looks at me while they talk to me instead of typing on the computer the whole time with things like ambient listening. So I think you're absolutely right. So do you have any advice for CNOs who want to begin implementing some sort of AI at their health systems? Because I feel like the task can be quite daunting.
It can be. And I think avoid the narrative of that it's going to take jobs, embrace it, embrace and learn what the capability is. And most importantly, ensure that your staff and your patients are part of the discussion.
Mhm. Absolutely. Yeah. Well, thank you so much, Terry, for your time. I'm really grateful to have had this opportunity to get to know you a little bit and hear your insights. And thank you so much to our audience for listening. Thank you, Terry.
Been a pleasure.